Hi everyone, welcome back to the Navigant Credit Union Broadcast Center. I'm GoLocal News editor Kate Nagel. Thanks for joining us for the 4 o'clock hour this Wednesday afternoon. We'd like to thank Nick Albanese for coming in to talk about his newest play, The Many Sides to the Reaper, opening next week in Cranston. We're going to go from entertainment to public health. I'd like to welcome my next guest, Dr. James Mcdonald, Medical Director at the Rhode Island Department of Health. Doctor, thank you for joining us today.
Kate, thanks for having me here. It's great to be here with you.
I appreciate it. So we can go right to our viewers, right to our readers. The Department of Health is officially kicking off its flu education campaign this week. It's hard to believe it's the first week of October and it is the season, if you will. Let's just start with nuts and bolts. I mean, do we have any idea what this flu season is going to look like?
That's a great question. Last year was a really bad flu season. If you knew anybody, you knew someone who had the flu last year. We saw twice as many deaths in Rhode Island last year as we did the year before. And we saw about 1,400 people in the hospital last year. What we know about this year's flu season is we think it's going to be a significant year. So it's another reason to get the vaccine as soon as you can. By the way, you can get it today.
It's already out there. I've heard of folks going around places. So talk with us about the Department of Health's campaign when you're out there doing that outreach. Is it primarily focused on the vaccination process, or what else do you hit on that you want folks to know as well?
So there's several things you can do. One thing is the vaccine, and of course that's something that's in everyone's mind. By the way, you can get that from the health department website, where to find the flu clinics. We're offering flu clinics almost every day up until now through December all over the state for anybody who wants it. There's other things you can do to protect yourself against the flu. It sounds frighteningly old-fashioned, but one of the best public health interventions is soap and water. And really, it's funny, as a physician, I tend to think, gosh, I did a lot becoming a doctor. I'm not nearly as important as soap is, and I just want to say that out loud. We have a lot of healthcare providers do a lot of great things, but soap is one of the best things we've ever invented, okay? It's really awesome. Washing your hands, sanitizing your hands. Do a really good job at it, by the way, though. When I'm not playing public health doctor, I'm a pediatrician. And one of the things I see is kids who get sick all the time. But one of the things about kids is they don't know to wash their hands. But as adolescents, as adults, we know better, And another thing you can do, though, and this would help me out a little bit, is when you're sick, please don't go to work. Said that to one of my friends at work yesterday, said, gosh, you look awful. And that's not how I want to greet my friends at work, but 101 fever, runny nose, cough, coming in my office, say hello. And I was saying, please go home. And you know what, to their credit, they did. But that's called presenteeism, as opposed to absenteeism. But sometimes when you think about our coworkers, and I know it's a hassle sometimes to not go to work because you need the money, but the bottom line is you're really not helping anybody when you do that. Those are 3 things we can do.
We have a very hard and fast rule here at GoLocal about not coming in when you're sick with the coworkers. And you talk about soap and water. Just a question for you, doctor. You mentioned sanitizer as well. Regular soap and water, should folks be focusing on the antibacterial? Is that kind of created a double-edged sword, or use any type of soap?
Really, any soap will work, and almost all soaps are antibacterial. That's really a marketing term. Hand sanitizer probably is better. You know why it's better is because we actually use it and it evaporates on our hand. Some of us, when we wash our hands, it's really more of like sprinkle soap, really quick rinse, but it's not like, in order to wash your hands effectively, you're supposed to do it for 20 seconds, let the soap actually sit in your skin. Who does that? Well, I do that, but that's me, okay? And I guess what we're getting at is you really do need to wash your hands the old-fashioned way. One way to keep that in mind is sing happy birthday to yourself twice. Maybe that sounds kind of silly, but it's one way to get 20 seconds through your life. And if you sing well, like I don't, it's still fun.
And so let's talk a little bit as well. I've also heard, and folks have talked about this, nose, eyes, ears, touching with the hands. Right. Is there one place that that the germs get in the quickest? I've seen competing claims that it's keep your hands off around your face, maybe.
So you get your hands on objects and little germs attached to objects. When you touch your nose, touch your eyes, which ironically all of us do this every day.
Without even thinking of it.
We don't.
No.
We don't think. A lot of us just do these things, and it's a matter of just habit. But that's how these viral particles enter our body, and that's how we get sick. So to some degree, where your hands go is where your flu goes.
And let's talk a little bit too, do you recommend, and I've seen more and more folks doing it, and I don't even know how many folks do, is your phone sort of one of the bigger germ conduits out there? Should you consider sanitizing your phone, one of those systems that does that as well?
So it's a thought to do. I think it's one of those things where your fingers go, like on keyboards. I mean, keyboards, they get a little bit ratty after a while.
Yes, they do.
When's the last time you turned yours over and had the crumbs fall out, right? But that's a different story, right? But, cleaning where your hands go, you're on our phones all the time. I recently got that app that told me how much screen time I'm on my phone. Wow, eye-opening to me, okay? And I thought I wasn't using my phone that much, but you know, if you think about where our fingers go with the phones, we live and breathe with these things right now, and it's kind of a little bit of a reflection of where our culture went, and that's okay, but that's a good example is after you touch your phone, that's a decent time to use some hand sanitizer. Does that mean you have hand sanitizer in your office? I have some in mine. It's a little green container. It looks great.
Keep some hand sanitizer on hand, and the Department of Health always makes their suggestion to get a flu shot. But let's talk about what happens when the season's here and getting sick. And we've talked with the Department of Health about this before. You know, when's that time to see the doctor? And whether you've had the shot or not, let's talk a little bit about that as well. So you're clearly coming down with something, and you're like, is this the cold or is this the flu? And when do I subject myself to an emergency room, or should I be going to a primary care physician?
Yeah, so that's a great question too. If you're getting the flu is different than a cold. Flu comes on generally abruptly. You're feeling pretty good in the morning, afternoon. Oh my gosh, when did I get run over by a truck today? And then you have this runny nose, fever, and cough. You know, flu, fever, and cough, really predictable with that. But the body aches, that's part of it. And so one rule of thumb is if you're going to get the antiviral medicine, generally the Tamiflu, you're going to want to be to the doctor within 48 hours or 2 days, because that's when the medicine works the best. So when you need to go is if you think you've got the flu, it's time to go see your doctor or wherever else provides your health care. Emergency room isn't the best place to go when you have the flu because it's not really an emergency, but it is a good place to see your doctor. But if you don't have space at your doctor's office in urgent care, it's another place where you can get that health care that same day. They're designed for same-day care. They might do a flu test. They might not. A lot of times if someone looks like the flu and it's flu season, like when we peaked in Rhode Island last year was January and February. That's peak of flu season. Still want you to get the vaccine today, though, because I want your immune system ready to go for that.
And so let's talk about that as well, going to your doctor. You know, there's certainly those folks out there that are like, I'm just going to ride it out. And we saw so many cases around the country last year of people, you know, seemingly healthy and then hit by the flu and fatalities. You know, is that ever an approach? I mean, should you not ignore the symptoms?
So I think it's funny. That's the old-fashioned approach is take some Tylenol and best wishes, chicken soup. And you know, there's a certain, like most of us are going to get away with that kind of thing. The thing that's kind of unpredictable though, and this is something we saw last year, is not everybody does so well with that approach, even healthy people. You know, there's the vulnerable population, those of us who are older, which I'm kind of in that group now, then the younger population, and those with chronic diseases. Those folks always really need to go get the doctor right away. It's a lower risk for those who are otherwise healthy, but we saw some surprises last year. And that's where it raises different questions. And I think if you have the capacity to go to your healthcare provider, get evaluated, that makes more sense to me. And you know, it's funny, my wife says to me, you think the doctor minds if I go to see him? Tell you the truth, I see my patients, I never mind when they come to see me. I like my patients. I'd rather see them than worry about them. And one way I don't have to worry about my patients is I see them. And
so when we hear those cases, those unfortunate ones of a seemingly healthy person, is this just a result of social media and an enhanced news cycle, or were there actually more in 2017 than we'd seen in years past?
So we have evidence there was more deaths last year, and there was more deaths in all groups. And I think that's one of the things to give perspective of. Just keep in mind, last year in Rhode Island, we're a small state, but we had 60 folks who passed away last year. That's a lot of people for a small state. The year before it was 33. So that makes us pause. Ironically, though, when you look at the hospitalizations last year, it was almost 1,400. But the year before, it was only 1,300. So we saw a slight increase in hospitalizations, but a more profound increase in people who passed away from that. Now, there weren't any children who passed away from the flu, thankfully, in Rhode Island last year, but there were some children who passed away in the country. And so I think we need to look at what do we do now? And, you know, there's misperceptions about the flu vaccine. The flu vaccine doesn't give you the flu. And it's really one of those things where you may say, well, it doesn't always work. I know it doesn't always work. It's not designed to prevent you from getting just the flu. It's designed to prevent you from dying from the flu, ending up in the hospital from the flu. That's really what the flu vaccine is designed to do. It's designed to prevent morbidity and mortality, and that's why it's important to get it.
And maybe final question, I might have some more as well, but that, again, stage of deciding to go see the doctor, get the Tamiflu. But if, you know, someone's gone to the doctor and they've got back home, what are the vital signs of things, you know, rapidly degress? And if you're a parent or if you've got a child, you've got an older person, but that's sort of, wow, I need to call 911 right now. Is there any way to know that it's turned from, and can there anything be done at that stage?
Yeah, there can be. So some clues that you're getting worse are it's harder to breathe. You're breathing faster, using extra muscles to breathe. Another little rule of thumb is I can't drink. It's so hard to breathe, I can't drink.
Okay.
Because, you know, keep that in mind. we pick breathing over eating and drinking, and that's really important because breathing is really critical. But if we're so having a hard time breathing, we can't eat or drink, you're in a situation where you really know to go seek medical care sooner than later.
And anything else you want folks to know? You're going to be going around throughout the state letting folks know all of these tips as flu season approaches. Doctor, while we have you here in the studio today, anything else you want to share with viewers?
So if you don't have health insurance or you don't have a doctor, we still have a flu vaccine for you. On our internet site, we have flu vaccine clinics all over the state, almost every day. There's even some today. There's pharmacies all over the state that want to give you the flu vaccine as well, and there's healthcare providers who want to give you the flu vaccine as well. But if you want the flu vaccine, we want to give it to you. Last year, almost 500,000 Rhode Islanders got the flu vaccine. Love to see that be a lot more this year.
Okay, well, Dr. James Mcdonald, Medical Director at the Rhode Island Department of Health, I appreciate your taking the time to come into the studio today.
Thanks, Kate.
So much.
Great hanging out with you.
Don't go anywhere. We'll be right back.